Happy birthday, dear Emily. Happy birthday to you.
Today is a big day on the pediatric floor at the University of Nebraska Medical Center.
We'll go to see one of our favorite patients. She's 6 years old and she received a kidney transplant. Today is her birthday and she invited us to go to her party. She has an EBV, Epstein-Barr virus, and lymphoma, one of the most feared complications in transplantations, cancer related to infection. When you receive an organ, automatically it's not your organ and your body would like to reject that organ and to get rid of it. To prevent that rejection, you have to receive medication. So that medication is gonna downregulate your immune system to keep the organ.
Today, Dr. Forescu and her team are working with another patient. Lauren received a heart transplant in April. If her lab results are good, Lauren will be released after a 10-day bout with CMV.
CMV is cytomegalovirus.
And we'll let you know about your CMV, but once you
Transplant organ recipients are highly susceptible to infections, and one of the infections is herpes viruses. Viruses can be transmitted through different routes. The most common is through intimate contact or through infectious aerosols when we speak, cough, sneeze. Viruses like CMV and EBV can be transmitted through the blood or through organs that we transplant. It's worth transplanting an organ that is positive for CMV or EBV because we can deal with these viruses later if we have to save the life of that person. Cytomegalovirus on general population cause a disease similar to mononucleosis.
When I went to the hospital in Storm Lake, I was very dehydrated and I was having stomach cramps and I couldn't walk, so they knew that something was wrong. And the coordinators thought, because I talked to the coordinators, and they said from the symptoms that I gave them that they thought I could have had CMV virus, so they wanted me down here to treat it.
What was life like before the transplant?
It was normal. I just went to school, hung out with my friends, played sports, what a normal teenager does.
In Lauren's case, she received a transplant while she was still a healthy, strong person, so she recovered very fast.
Emily had swelling in the eyes, and we thought it was just allergies at first, but then we took her in for a 4-year checkup, and they said, oh no, there's something else going on, and it turned out that she had kidney failure. It's one of the easier transplants, if you want to call it that. You still have a lot of follow-up care, but she contracted a virus.
It flickers.
I had a surgery on my daddy, a kidney surgery. Then I got sick again.
And you got sick again. So you had to come to the hospital again?
Mm-hmm.
One nice kiss. You did a great job.
EBV infection in a normal person might be asymptomatic, so might have the infection and not know it. Emily, her multiple chemotherapy episodes, she developed fever and she had multiple bacterial infections.
This little virus that you and I could fight off just about killed her.
A virus is a microscopic infectious agent that cannot live or reproduce outside a living cell. We see here the structure of a virus and the structure of a human cell, and is a huge difference. The viruses have a very simple structure, and our components are vital for the virus to live and replicate. So in a way, we can say the virus is a parasite, needs our body to live and replicate. First step is attachment to our cells through different receptors.
Next, there is fusion of the virus to the cell membrane, and the virus enters the cell. It moves from the cytoplasm into the nucleus through small holes in the nuclear membrane.
Within the nucleus, viral replication takes place. The viral DNA is made into an RNA copy, and this is used to make viral proteins. The virus then moves from the nucleus to the cytoplasm and is released from the cell through a budding process.
And this is what we call a lytic process, when our cells at one point might be destroyed, and is when the patients would have symptoms because of intense active viral replication and cell death. When we talk about herpes viruses, we have 8 viruses, but for our interest, we have herpes simplex virus, VZV shingles, Epstein-Barr virus, cytomegalovirus, and human herpes virus 6, 7, and 8.
Dr. Florescu works with a team of doctors and nurse practitioners to help patients who have developed viral infections following transplant surgeries.
And we always try to discuss the cases and make a plan together to make sure we have continuity of care. To reach a final diagnosis, we work close with radiology department, with a pathology department, and also with microbiology, including virology and molecular lab. Just to make sure that for reactivation of some viruses is going to be most likely around transplantation. So this is why we treat the patient, we get rid of the symptoms, we clear the blood from the virus, we clear the organs from the virus, so we improve the symptoms. But herpes viruses are viruses that sleep in certain cells. So they are going to be at risk for reactivation of the disease in the future.
Now that we've been through it once, she should start to build some antibodies, and the farther we get out from transplant, the better that, I mean, not that she couldn't get sick again, we know that, but maybe not as harsh as it was this time, or?
No, in few months, the chance of getting the CMV reactivation is going to be much lower.
Okay.
My first few years, I would look at every kid and I would see my daughter. Every time I would feel I'm not doing my best, if the outcome was not the greatest one. You burn out if you do that, but you cannot be detached completely. We are not machines, and they are kids and you love them. Some of their stories are heartbreaking, but also are rewarding because they have great outcomes. They are the ones you want to fight for, because at the end of the day you go home and you did something for them.
This is a bug. If you're mad, you have to squeeze it.
That's good. That's good.
That makes you mad. Twinkle, twinkle, little star, how I wonder what you are.
Oh, that was very nice. What a nice song.